Yes, Dr. Shifali, a very good evening and welcome to the Toppers Talk of Dental Lummies Academy. And before starting the talk, I want to introduce Dr. Shifali. And she is the student of Comprehensive Course Premium Batch 2023-24. And she has scored a rank of 123 All India in NEET MDS exam and 21st rank. That's the key, isn't it? 21st rank in INI-CET May 2024. So welcome, Dr. Shifali.
Thank you,
And
sir.
so, Dr. Shifali, first thing I just want to know from you is your journey from the beginning till the INI-CET results in a short. Then we'll go into deeper and deeper into each and everything. Okay. In short, when did you pass out? You're from Haryana.
No, sir. Actually, I did my BDS from Dr. HSJ Dental Institute, Punjab University.
Okay.
So I belong to Panchkula, which is near Chandigarh.
Okay.
So
So that's why you want to go for PGI, USA.
yes.
Yeah. Okay. So then we'll come to that in the end. So okay, you did from Punjab, and yes, were you a topper?
So yes, I used to score good marks. Means my target was that I have to gain the knowledge, and I was not behind marks or something, but my target was like I was interested in few subjects. So
Okay. So I just want you to tell me, were you a gold medalist or class topper?
I was second in my final year overall.
Yeah, fine. Yeah. So what do you think? Do you need to be a topper to crack NEET or INIC?
No,
I
they
will
are
say
very.
no because I was never a topper. Okay. So, but then people have to know it, doesn't it? Do you need to be a topper?
No,
No.
you don't need to be a topper or something. It's a very different exam. It's MCQ exam. It's not theory exam. In theory, you have to learn everything and you can write anything and you will get marks,
Exactly.
passing marks. But here you have to revise multiple times. I revised like 6 to 7 times.
Six
Dental.
to seven times. Okay. So we'll come to that. There's a question there. But now I want you to tell me, when did you pass out? Which year?
So I passed out. I did completed my internship in September 2022.
Okay.
And from September onwards, gave my INI-CET November 2022 and then NEET.
And that is where your journey started with 276th rank, and you came into the notice.
Yes, sir.
Dental Lummies Academy. Okay, there is one person there with rank 276. And it was your first NEET attempt, isn't it?
First,
This year. This year was your first NEET attempt. Okay, so when did you thought, okay, I'm going to start during internship, or when did you start of starting your preparation?
so from the start of internship, firstly, I was not in a mood to give MDS exam. Then I was looking out for other options. What all options are there? But then at the end, I thought that I have to do my PG. So I started preparing for that. And during my internship, my target was to complete all the lectures.
Oh,
My
Dental Lummies
target,
Academy.
yes, sir.
Okay, we'll come to that also. So when did you join your Dental Lummies Academy? When did you join Dental Lummies Academy?
So I joined in November last year.
November 20. So you are writing, so let the audience get a clarity. You wrote the exam in 2024 March.
Yes, sir, 2020.
So 2023 was there. So you
Yes,
joined November 2022. Am I
yes, sir, 2022.
So that was our first batch or something like that. At the
Yes,
end of November, so you got like almost 1 year. Uh,
yes,
yes.
sir.
So that was in 2022 end, you joined. And 2023 was the year of your preparation, and 2024 you wrote the exam in March. Okay.
Yes.
So that was one full year preparation. So let me come to this. Many people think that, okay, when you're clear, your opinion, okay, uh, 6 months is enough. So what is your opinion on that? 3 months is enough. 6 months is enough.
They are not enough. I think 8 to 9 months.
8 to 9 months is needed minimum.
You are very serious and you are preparing like seriously and with giving mock test regularly and giving them seriously and seeing your mistakes. I think 9 months are
Okay, so
enough.
now the next question comes. When you joined, how serious were you? So
So
because
I was,
yeah, because this has to be very clear. A journey of a topper is very important because I personally have gone through it. Now people think that toppers start, with all that ready and then they start. So I just want to know your journey. How serious were you in your initial phase?
Initially, I was not that serious. My target was just to complete this lecture when it used to come in the app. I used to do it maximum 2 days. Within 2 days, I used to complete my lecture. Then slowly I got to know that private college fees is so high. So I was like, no, I have to go into government college.
Okay.
So my target was I have to get that college in my first attempt.
So initially, when you did lectures, you joined in November 2022. So you were doing lectures. So how many hours of preparation you were doing?
So I was preparing along with my internship.
So you were doing how many hours? So what do you suggest the interns? How much you should do initially?
During my postings, I used to take out time to do my lecture, whatever time I get, like
Mhm.
around half an hour or 1 hour.
Mhm.
Then after that, I used to come home around 5:30 or 6.
Okay.
So then I used to study for around 3 to 4 hours maximum.
So 3 to 4 hours outside and 1 hour approximately in your college. So which will come to around 5 years, 3 to 4, 4 to 5 hours. Okay. Your voice, yeah. Okay, fine. All of a sudden that. Okay, so that was your starting. So when did it shifted to what? When did it increase? You said that you wanted a government college seat. So by the time you became serious, how many rest of your internship was remaining? When exactly did you finish your internship? You said
So in September 2023.
September 2023. So till then, how was your journey? How was it increased? How much increase was happened in the whole internship? Because many interns say that we are not getting time to learn.
Yes.
So how was definitely that is very true that you don't get time to do. But then how much? So this from 3 to 4, all interns listening. She prepared for 4 to 5 hours initially. Okay. So was that when you became serious? You said initially you just followed lectures. So initially only lectures only. No preparation after coming back. Was
Only
that
lectures, and I used to hear your voice notes that revise in the morning. So I
okay?
used to revise every day. I had made a schedule that I have to revise in the morning.
Okay.
Just
So am I correct if I say that you were revising only, you were learning only for 1 to 2 hours initially, or was it like, is
initially
it
it was like 2 to 3 only.
2 to 3 only? Then you thought of
Then
going to,
slowly 4 to 5, and
yeah,
then it increased to like 6 to 8
6 to 8 during internship
by the end of my internship.
by the end of. So how did you got that time? Because I didn't prepare during my internship. So you have to tell the interns
My
how.
during my internship, the last months were like pedo or some light departments where you don't get much work to do. So I used to I used to finish my patients, and then I used to listen the lectures,
Hmm,
and sometimes I used to come home early to give my test
that's
subject.
dedication. Good, good. Subject-wise test. Okay, so how was it like? How was it? How was your day like when you reached that part of your preparation? How was your preparation day like, or the entire day like? You go to college, you do the lectures from the college.
Yes, from the college.
Then how?
In the break, I used to like eat my food,
Hmm.
and then I used to listen the lectures
Okay,
because I had a target like if this lecture is given during this day, I have to complete it today only,
okay,
or
fine.
or maximum by tomorrow.
Okay.
So I used to complete my lecture, and on Sunday I used to revise my notes and give the test.
Give the test. So topic-wise test paper was not in your concern
No, sir,
initially.
I gave the topic wise test, but I gave them during my internship only in the weekdays. I
Weekdays.
used yes,
Were you up to date with the topic-wise test paper?
I used to give them not so seriously, but I used to see my mistakes. What are my
You
mistakes?
see your mistakes. So if then to be very precise, when was this?
So in the
Last
last month of my internship.
last month, which was September 2023. So was it September or before that?
September was like I was putting in 6 hours.
6 hours.
Before that, 4 to 5 hours.
Okay. So now you are in September. So you have got October, November.
October, November, and November was AS.
INI-CET came,
Yes, sir.
isn't it? So your rank was 276.
Yes, at that time, I did only AIMS and PGI questions from the Pulse, which you told that do only these questions from the Pulse, and I was not so well prepared at that time. So,
Please note all of you, rank number 276 is not well prepared in November. Isn't it? This is true. Okay, this is really, really true.
yes,
People think that you have to become perfect before you get into your exam. Okay, so then they say that, okay, I'll not write November aims. But then you put your 100% effort. You were ready to put your effort. You did, you followed the guidance properly. Like he told you, AIMS PGI, focus on AIMS PGI. Then you got 276th rank by November.
yes,
Okay. I'm sure November was a better month of preparation, a little bit more serious, 6 to 8
yes,
hours or even
yes.
more.
8 to, after November AIMS, I gave 8 to like 8 to 9 hours.
8 to 9 hours. Okay, fine, good. So now my question is, if someone, this is another misconception people have, I just want to hear from you. Now, this will give a student thinking that, okay, I'll start by September. Okay, like you said, 8 to 10 hours. I'll increase, sorry, 6 to 8 hours. November 8 to 10 hours, and then increase further. Is that possible? Because personally, I believe you can't right away jump to, 6 to 8 hours initially and then 8 to 10 hours. Is that possible, or do you do it in a stepwise manner?
I did it in a stepwise manner only. Like you told, like increase by half an hour, then increase by 1 hour.
Exactly. Then you will never feel that, saturation.
Fatigue.
Because if you start from 8 to 10 hours, one thing is which is going to bother you. So that is my next question. Did you ever felt that, to give up or feel that, no, no, this is not for me, or I'll stop the preparation because I'm not able to catch up all these things? Did you ever felt this in any phase of your
For
preparation?
my NEET exam, 1 week before my NEET exam, I was like, I'm not going to give the exam. I'm so fed up and I can't study now. So I gave myself a break of, like I said, I will do 6 hours today.
When
So
was that?
that I don't feel
When was
one
that?
week,
1 week before you decided that. Even
one
Nandini,
or 2 days.
Nandini said, I want to listen from you also. Okay, Nandini, Dr. Nandini also said me that, sir, our way of preparation in the last week is a little hectic and
Yes.
stressful. So I decided that that's why November memes, I let you all a little free, if you remember. I told
So
you I'm not going to put any schedule for you. You go. So how was that, friends?
in May aims, I was like, I don't want to sleep now. I just want to study, study, study. And
Okay.
in the last week, I was like, I have to give it everything. I have to give my best. I don't know what the result will be.
So what made the difference? In November, you wanted to. So see, all of you, please listen. How many of you are there? Okay, please listen. NEET topper rank number 123 was almost about to quit 1 week before the exam. So this is the reality. And the reason I'm sure you will say that I'll not be able to. No, if you believe that you will be getting 123rd rank, you will never quit. So why do you want to quit is because you thought that you'll not be able to. Am I
So I
right?
was totally tired and of studying, so I wanted to leave my books for some time.
Okay.
But I used to study for 6 hours, like 1 or 2 days. I gave myself a break. Then I
Mhm.
studied for 6 hours. Then I told myself, no, it's just 7 days you have to study. So give it your best. So I
Mhm.
studied 7 days. 1 week before, I studied for like 8 to 9 hours.
8 to 9 hours in the last week. Okay, fine. So this has to be in a consistent way increase. That is what your instructions to all the students out there. So now, okay, last week before the exam, you felt like quitting, but did you ever felt this before when you began or in between, or you're not able to do it? Anything which was a kind of a challenge you faced?
So I think I have sent you many messages like, sir, I can't do this. I'm
Okay.
not able to. When the NEET was postponed, I was like totally, I thought that I can't study more now. But I think it's your self belief which will take you forward. You have to. I had a small diary. I used to do journaling. So I
Oh,
used to write that I have got a seat in NEET MDS,
yeah.
government college.
Yeah, which I used to. Okay, did you used to try that 15 minutes dreaming every day?
Yes, yes.
How was
I
that?
I did that before sleeping. I
Before
used to
sleeping?
imagine like I am already in my dream college.
Yes. So what was that college, in fact? Which was that?
So PGI Rohtak or KGMU Lucknow.
So now you got hopefully no AIMS or PGI.
Yes, sir. In
Mhm.
AIMS also, I had a picture of AIMS Delhi in front of my desk.
Okay, fine, fine. That's nice. Okay, excellent, excellent. So all of you, those who are listening to this is very important to keep you going. Okay. So that was your journey, I would say, in overall. Okay.
Yes.
Now, what do you think is your biggest weakness, if I ask you, in studies? Like,
So I think I forget some things like facts, simple facts, which are like you have to repeat them, revise them again and again. So I
okay,
used to like have a diary, small diary. I used to write my fact, all the facts there, and I used to flip the pages and read them so that I get confidence, like I can do it.
okay. So if I ask you, what was your strength on the other side of the spectrum?
Tenth is my positivity and my self belief.
Yeah, that is the key. Okay,
Yes,
you know, I don't need to tell the name of the person who was like along with you, isn't it? If you were second, that person was first. If you were first, the other person was second. You know the name, I hope, isn't it? And what made the difference, even I felt, between
yes,
you and the other person was that positivity. The other person was always doubtful,
yes,
isn't it? And my advice to all of you, is that be positive. Whatever happens in your life, okay, be positive in everything. And I know the sacrifices you have taken. I don't need to mention that. Okay, so that is very important. Stay positive in any phase, isn't it? That's your advice to all the
yes.
students. How
Stay
was your
positive and manifest your dream.
manifest your dream? Think of your dream, isn't it? Exactly. So how was your examination hall day?
It's a NEET exam or
NEET
NEET.
exams. That will be no. See, November AIMS May is something you know that you are going to get into NEET. So it will definitely be
I was relaxed.
yeah, relax. So that is why you have got 21st rank. I'm sure one part is that only because your ability is more than 123. I knew that. Okay, because UPSC you got the second rank, which I didn't mention yet.
Oh,
So
PGI house.
PGI house job you got a second job or second rank. So okay, how was the exam day in NEET?
So I just went there like 1.5 hours before and I sat and I was telling myself that I just have to focus on the question. I don't have to think about the rank or the result
Excellent.
or anything which I don't know. I just have to see like this is my questions. So what can I do to solve it? I was like in between. I was like I can't do this in during the exam. I was like I can't do this. It's very tough. No repeat question is coming
Yeah,
here.
yeah. Less than 10 repeats.
Yes, sir.
So how was that feeling? That is what I want to know. When you see these questions, what did you say to yourself?
So I just closed my eyes and told God that you have to handle this. Just
Okay.
handle it and I will do it now.
Okay, I
So
still
I
remember your message which I got after the November AIMS. No, so the May AIMS. What was that? Do you remember?
yes, sir.
You
I told
attempted
you it's
attempted
very, it was very tough.
it was very tough and I felt a bit sad when I came home. Okay, but I did my best. So that is the person who got in 21st rank. So
So
this is the yeah,
I told my father that after AIMS exam that
yeah,
I don't know if I will get my seat or not. Exam was tough. But
yeah.
my mother is really very positive and she told me you will be in top 10. So I
Okay.
used to repeatedly tell myself I will be in top 10, I will be in top 10.
Repeat it on the exam day.
No, after the exam.
After
After,
the exam, you thought, okay, well, I'm going to read out your message on your WhatsApp, the key points there after the NEET MDS exam. Okay, so just let me know your feelings. Exam was tough. Image based questions were less, and major questions were application based. Okay, you left only 8 questions. You attempted 232.
I left 10 questions in AIMS.
No, neat.
NEET I left 8.
8 questions. Okay, all I can say was I kept my calm and give my best 3 hours. Okay, so that was a kind of more positive. Though, okay, so then what was that stressful moment? Because I saw your AIMS response was, I said, I'm sad.
Yes.
The more you say, is that true? The more you sad, the better rank you get.
I was like, questions were tough because they were tricky questions.
AIMS one.
Microbio, biochem, so many questions came from that.
AIMS or NEET?
AIMS,
AIMS.
AIMS.
Okay. Okay. So okay, we were okay. So you have to maintain the coolness of your mind and go ahead. Even the exam is very, very tough. So
Yes.
that I've been telling you all even before the exam, and now I'm repeating this to all the current students. When it is tough for you, it's tough for all. Did you thought it that way?
Yes, sir. My target was in easy questions. I don't have to make any silly mistake. I
Okay.
do them correct in AIMS
Okay.
because I think I did some silly mistakes in NEET.
Yeah.
So my target was I don't have to do any silly mistakes in AIMS. Tough question is tough for all, so don't think about it much. Do
Okay.
the easy questions properly.
Okay. Which one do you think was more tougher, NEET or INI-CET, the one you attempted recently?
INI-CET.
INI-CET was tougher. Okay. Okay. So yeah. So you said about the challenges you faced. Okay, can you elaborate a little bit more on that? What were the challenges from the beginning till the end? If you can divide your preparation into the initial phase when you started just with lectures, then when you increased into 6 to 8 hours, then your third phase where you were at your full stress or full stretch.
Actually, I was like, I have to complete my lectures and my topic test.
So what was the
And
challenges? Were you able to catch up with the schedule or were you lagging behind
yes, sir, my target was this only. I have to go with the schedule.
with the schedule? So lectures you catched up. Later
Yes,
you started
but
giving.
in DM, I was like lagging behind. So one day I cried that how will I complete so many lectures of DM and cons combined? So, but I completed 2 lectures per day of DM and cons.
Two
So
lectures. Okay.
this I completed the entire.
So, what do you say to those people who lag behind? Because many students, the biggest challenge we have got a lots of contents giving you everyday contents. Now, one more thing we have started is live sessions also in between. So, what is your advice to those students who are lacking behind? Should they stop their preparation? That is a bigger first thing comes to their mind. I'll stop my preparation because I'm not able to catch up. So, what is your advice to them?
I think you should be consistent. Consistency is very important than your uh, number of hours or everything. So be consistent and do not lose your hope. Always be hopeful. I will complete my lectures even if you are lagging behind. That's okay. Even I was lagging behind in many things.
Yeah.
So I completed them. Be patient. Be patient with your preparation.
Okay. So, were you someone who took down the notes
Yes, sir, I
from
took down.
beginning?
Yes, sir,
From
from
beginning, you had your lecture notes.
yes, sir.
Okay. So how did it help you?
So I think it's easy to learn when you write with your own handwriting. It's easy to learn that.
Yes,
So
yes.
I had 3, 4, I think 4 to 6 registers.
Okay. Okay, fine. So which is there with you? Okay,
Yes.
good. Now next question is, I used to every time repeat, revise the next day morning, revise on Sunday. So how and when did you start this? Did you start it right away initially or later?
So I think after 2 or 3 months.
After 2 or 3 months you started. So okay, only after 2 or 3 months. So till then you were just watching the lectures and going ahead.
But
So
my suggestion would be like do it from the start.
from the start.
Revise in the morning.
What
Every
when did you realize that okay, I have to start revising every day morning?
so when I got a bit little serious, so I my thing was like I have to revise because it was easy then to give the test and to revise on Sunday also. So,
Okay, exactly, exactly. Okay, did you have any timetable? Your specific timetable?
so I used to make timetables, but I
Break
never
the
used. Yes,
timetables were hard to break. So this is one advice to you all. People are too much worried that I am not able to follow my timetable. Like Dr. Shifali has said, the most important thing is to be consistent. You're learning 3 hours a day. Consistently learn 3 hours a day. Increase a little bit, 30 minutes, 30 minutes, 30 minutes. And then that will slowly, you will jump from this 4 hours, 5 hours into 8 hours once you start. So did you enjoy your preparation?
yes, sir, I used to enjoy my preparation. After my NEET, my father told me that just give the AIMS exam like this only without preparation because I was very tired studying. So I told him, no, I will not give the exam. I'm tired. I will not give it now. But
Oh,
after 2 to 3 days, I was like, I have to study, and I was feeling some void inside me. No, I have to stay with my
no,
book.
you're missing something. This is what I get the message from all after the NEET exam is over. So I'm missing something. I want to learn. So this even I felt it. There's some void space there which we are not able to fill with anything.
Yes.
Yeah, that is true. Okay. When did you for NEET? When did you start feeling that okay, I can easily make it? I can make it. Did you ever feel it, or if not, or if
So
yes, then when did you?
in my mock test, when I used to see my improvement in marks,
In
then
March.
I then that gave me confidence. Yes, I can do this.
Okay. So now coming to the number of revisions. So one of our toppers said me after the interview, said actually I said 5 to 6 times, but actually I didn't do that much. But then I don't want to discourage students that this is enough. It was Dr. Sumaya who was your senior in your senior batches. So I want you to be very sincere about it. Okay, don't worry because let the people know that see, let's not be unrealistic because Dental Pulse is now 4 volumes, isn't it? So, how was your revision? How many times, if I divide into 3 parts, your lecture notes is one thing. Okay, I want you to be roughly tell me your lecture notes. How many times did you revise?
So I revised him during making the lecture notes in the morning. So
Morning,
every
that is one.
day,
So, morning and Sunday, definitely.
Sunday, and when there was a combined test of like 3 to 6.
Grand test. So, you revise for the grand test. Okay. So, morning, how many hours did you revise?
So initially half an hour,
Enough
then
quickly rushing through.
so quickly.
Okay, so now my question is, after your lecture notes, how many times did you revise your dental pulse?
So dental pulse also, I think same. Like I did it in during my lecture notes when I used to prepare. I used to do my MCQs, and
Hmm.
then on Sunday I used to revise dental
So
pulse.
total, if you tell me all the subjects combined, how many times?
So
So
total 7 to 8 times.
7 to 8 times. Now, those who are listening this don't think it is impossible. It is definitely possible. It is definitely possible. Don't worry. The problem is like people think, no, I'm taking this much time to finish one round. So it'll, no, what you say, it'll slowly get faster and faster, isn't it? The fast you become faster and faster. And I'm sure your last revision, your eighth revision will be definitely in few days,
Yes.
isn't it? In few days time, the last, I'm sure. So that was your notes and dental pulse. And what about the question solving on the app, test papers
So I used to revise them on Sunday only.
on
Like
Sunday?
there is grand test or subject wise test.
Okay,
Then I used to just look through them, look through the questions.
okay. And you used to bookmark it or you just leave it there?
I bookmarked it and I used to note few points in my notes only.
Okay, you just connect it. Okay, that
Yes.
is also very good. Now, yeah, I hope any now students, if you do you want any clarity in any point or you want to ask from any regarding anything, if you have any clarity. So yeah, one thing I forgot to ask you. Besides Dental Pulse, okay, Dental Amaze Academy app, did you follow any other books
No, sir. Only dental pulse and notes.
and notes? So what about Sparsh Gupta across all those?
I bought Sparsh Gupta, but I think I read only the first page, then I moved to dental pulse.
This is my advice to all of you who are too much worried about Sparsh Gupta and across because we need to tell them this is there. Otherwise, no, they will tell that okay, if this academy is following that. See, you don't have that much time, is what I believe personally. Because if you want to revise it effectively, you can't go. But then, yeah, sometimes if you're not an intern, like you were an intern, so if you're not an intern, you can start right beginning. Dr. Sumaya did it, and when we were interviewing her, she said that then first after first reading, I kept it away. I did it once, then I never tested. Okay, so you didn't do any other book,
No,
am I
sir.
right?
Only pulse and notes
And
and
then
mock.
mock test and exams and lectures,
I
isn't
had
it?
a separate register, like I used to note down my mistakes in mock test, and I
Okay.
used to like reevaluate myself, like am I lagging behind in revision or is it my silly mistake? So I used to write there that this question, you did a silly mistake, do not do it again.
Yeah, I used to tell you, write it down. That learn from your mistakes, isn't it? Learn from your mistake, because you once you write it down, this is your mistake and this you should not repeat it. It might take a few seconds, but you'll not repeat it again. This is advice for all
Before
the.
giving the next mock test, I used to look through my register, my
There was
mistake.
a good amount of sincere effort there, isn't it? It doesn't work out. See, many people think that if I do, now you're saying I do lecture, I did lectures, I did pulse.
Yeah.
Okay, and app questions. But it doesn't stop there, in fact. It is all the small, small things which you were saying is also going to add up on that. A sincere kind of analyzing yourself, making you positive, pushing yourself forward, isn't it? So now let's come. Is there anything which you want to tell or advise the students? Anything if I missed out in asking you?
So I just want to say that please believe in yourself, you can make it. It is not like very difficult or something. It's easy if you are consistent with your efforts. I
Exactly.
used to believe I will make it. I will be in top
Me
rank.
too. Me too. This is the most important thing, because unless and until you believe that you're going to do it, you will never do it. They'll be
Even,
doubtful every time.
even
Yeah,
if
very
you get low marks in mock exam, your marks do not decide your rank. You just have
exactly.
to see your mistakes that I don't have to repeat this mistake in final exam.
Exactly, exactly. So like, see, you used to score in the mock exam 160, 151, that range. Even your NEET, INI-CET mock, isn't it? So I need to tell you, don't worry about the marks, isn't it? So there is a person who scored 21st rank. So this is again, your, as you said, your marks are not the final deciding factor. It's all your consistency, your efforts you're putting, and you're pushing yourself, your positivity. And finally, I know you have said all this connected to Dental Amaze Academy only, but then I just want to tell, I would just want to know from you, how was like, how did Dental Amaze, if I ask you to explain in 2 or 3 sentences, how did Dental Amaze Academy help you? Two or
So
three sentences, short.
I think this academy gave me
Definitely,
confidence.
okay, one thing. Definitely, it's your effort. No doubt, 101%. So far, you're saying all this, your efforts and everything. But then the supplementation came from Dental Amaze Academy. So how was that?
So I think I used to wait for your message in the morning. I used
Okay.
to get up and see sir का message नहीं आया अभी.
Okay.
Then I
Okay.
used to like it was my like sort of booster for me every day morning. I
Every
used
morning. Okay. Okay. So let me be very sincere in that. I used to feel that, am I putting too much of voice messages in the groups?
you should put more voice messages.
So then I thought, okay, at times I just decrease it. Okay, but then yeah, so it is benefiting you all. Definitely, that is needed. See, we all have that positive motivation inside us. We all know that this is the fact. And someone is reinforcing you from behind. That is going to, okay, yeah, that is true, isn't it? So that was one. Okay, voice messages. So little bit more.
So apart from that, I think the material is very concise and you can't revise everything. If you think like I will read this also, three, four books, you will not be able to revise it in the end.
Yeah,
You just
exactly.
have to stick with one. I just stick with dental pulse and my notes so
And
that I get time to revise them in the end. That
okay.
will give confidence. Yes, I have revised everything.
Okay. So I'll ask you one final question from my side. How important is understanding the basics? And how did Dental Image Academy help you in that?
So basics are very important because I think in NEET and AIMS, the questions were from basics only. If your basics are clear, you can build up on that. So the lectures gave me like your lectures are very nice. I used to like be thankful like prosto lectures. I never understood that during my BDS course.
Okay. So, okay, fine. It's different experience for different students, but definitely yes. You will say RPD was that, or
Sorry,
completely prosto, whole prosto or only RPD part
the RPT and FPD part,
was made easier for you.
jaw relations.
Now, this there is one misconception with the students. Okay, I'll end up here. You said about basics. You said about understanding the concepts. Now, lots of application level questions are coming. So now you said that you have to be clear with your basics. So how do you think? Because when I say this, now you say it because you're just a new. You people can say, okay, I did my exam in 2019. At that time, it was no clinical questions much. It is true, reality. But now you have just read it. One of the exam where there was less than 10 repeats. And you got INI-CET, which was tougher than that,
Yes.
isn't it? So, what do you say to the aspirants? Like, see, what we are finally doing is what? We're doing our dental pulse, we're clearing your basics and concepts. We're doing the same thing repeatedly. Today also, when I was taking the lectures, I told that this is the basics, this is what you have to know, and all those. So then, when you go for the exam, people say that lots of new questions, lots of clinical questions. So how do you, connect these two things? I want to hear from you.
So I think if you do like multiple revisions, every time you read the same thing, I used to get a different perspective out of it.
Okay.
Like every time I used to, suppose jaw relations, every time I used to read that, I used to like get a more different perspective, and that
Clarity
helped me in my clinical questions.
in questions. Okay. So you connect, am I right? You connect a clinical question with your concepts and you were able to answer it. Isn't it? It is not that you're getting, so all the students, it is not that you're getting lots of clinical questions and doesn't mean that you need to read textbooks and fully thorough with your syllabus. It's the same thing you have to learn. Dr. Shifali is the proof to that, testimony to that. The same thing you have to learn, but in a more clearer way. Like he said, the more you revise, the more clear it becomes, the more easy it becomes to connect. Because
Yes.
recently one student said, "So I keep on learning new things."
No, you won't be able to revise then.
You weren't able to revise, and when you get a new question, you'll not be able to connect it. So that's it from my side. I wish I could have asked a lot of questions, but then, yeah, let us make it till then. Any student want to ask anything? It's a golden opportunity to you all. The fresh rank holder, and you want to know like what you're going to write the very next one. Interns can ask anything. 2, 3 questions will be taken, and then we'll end the session. Anyone? I hope someone will be there. Okay, put the question. Put the question quickly. Is there anything pending? I think you have explained everything perfectly because the whole thing. Someone, if there is any doubts, people are shy. People are okay. Okay, one final thing. How much do you think is important is your interaction with the staffs during the live sessions? How much did it help? Because you know that you were from the first batch to the last year. I wanted interactions. I wanted interactions. And what I've seen is people who interact more is going to be more probable to get in. People, all of you, please put your questions if you have any. Okay, then we'll end up. If there is no question, we'll just close it now after this. So, how important is interactions?
So I
How?
think
Yeah.
interactions will give you more confidence,
Okay.
because otherwise it becomes really boring to study and no interaction with
Yeah.
the teacher. So when I used to repeat my name in the live session, gave me confidence, and I used to feel like I have to study. So I'm in the ICE.
You get that when I used to repeat your name in the
Yes, sir.
yeah. So you got that confidence. Okay, good. So I hope there are some people out there in live sessions. See, I'm seeing some Shifalis and Nandanis in this batch also. Okay. Uh, I don't know when did you came to my notice as a when was it? Do you remember?
So I think radiology live session
When was that? Which month was it?
before INI-CET November.
Before NSVT November. Okay. Okay, fine. I started noticing you like you're answering it correct, many questions. So I hope people don't have everything is clear. Okay, because I think you have explained everything from A to Z. So thank you so much. Thank you so much, and all the very best, Dr. Shifali. Keep in touch. All of you need your help in Dental Amaze Academy. We'll be having more once you join PGI. We want your experience in PGI. How was it?
Yes.
Okay. So even I want to visit PGI. I always, be very frank. I always think that okay, someone in Ames because we have students in GDC Chennai, we have students in GDC Kota, we have GDC Calicut. We have got in different places we have got students. Okay, even in GDC Mumbai. But one dream was there in Ames in PGI.
So
Isn't
this is
it?
also my dream. Like I used to write in my diary, I will be interviewed by sir one day.
Wow, that's
This
okay.
this is my dream.
This was your one dream, so this also came true. God bless you. God bless you. So yes, that was like definitely my dream. And I this was a little personal. I'm saying this. I told my wife every time, every results, I was so anxious. Okay, I want to be like, what will be my students doing? How much will this score? What will this score the rank? And do you know, the morning you sent me the message, I got All India rank 21, I forgot. I forgot there is going to be results coming. Otherwise, the night I'll not sleep. Tomorrow results might come every day to, like, by the time when the results are going to come, tomorrow results are going to come tomorrow. I forgot it completely. And you send me was, that one few moment that we are, a kind of in a different world, not realizing
Yes.
reality or not. Isn't
So,
it? You saw
uh,
India rank 21. Okay. I was looking that you are rating the All India rank only or something else, because that was like, wow. Okay.
yes.
Then Nandini's came 44. Then, like, it kept on coming. Like, okay. Yeah, you were saying something.
Father saw the result. I gave it to him. Like every time he only sees my rank. So I gave it to him. He said 21. I said, no, 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 not possible. What are you saying? Check again.
Okay. Okay, Dr. Shifali, thank you so much for being here. Definitely it was your dream, but then it is our pleasure to have you. Okay. I don't know how to tell that there is a proverb in Malayalam. I don't know how to translate it. You became better than your teacher. That is you. So it's my pleasure that someone is there, because every time I see this, my rank is 120 in NEET. So I see these people 120, 119, 120. Your NEET score also 123. And before that, but Meghna Punjabi scored 15th rank in
Yes,
AIMS. Yeah,
yes,
but then for her, it was like, she, at that time, the seats were very low.
yes,
Okay. Then Dr. Roshna did 65th and all those things. But then, yeah, after that, it went into the hundreds. Now it's 21. It is the best rank, I would say, considering the fact that getting into AIMS, because Meghna Punjabi got 15, but the seats were very low.
yes.
Okay. Okay, Dr. Priyanka said, thank you so much, sir, and Dr. Shifali for motivating us. Yes, thank you so much,
I
Dr.
want to give one last message to everyone.
Yeah.
Please believe in yourself. You can make it. Because it's not like you can only be a topper and do this. That is a myth, a big myth. So please
Exactly.
believe in yourself and the things you do in a day. Focus on the things you did today and be proud of yourself. Don't focus on those things like you didn't do this one or two topics. Focus on those topics you did today and be proud of yourself for that, so that you are always positive.
Yeah. So remember the mantra as I used to tell you. Night mantra. You talk about that and connected. Before you sleep, before you wake up. Isn't it? Yeah. So yeah, believe in yourself and be positive. Okay. Okay, doctor, thank you so much. Have a good day and all the very best for your future. Have a wonderful, amazing future. God bless you. Bye.
Thank you.